Hello, ma. Hello.
Thank you very much, Pharmacist Olani. So we'll go straight on to the meeting. And I would like to welcome Hello, can you hear me, please? Hello?
Yes, we can hear you. We can hear you.
You can go ahead.
Okay, so sorry. I think the network logged me out. So I was trying to recognize our participants tonight. I can see Professor Bolajoko Aino on the call. You are welcome, ma. I can also see our presenter, Pharmacist Folashade Ogundele. You are welcome. I recognize the presence of Pharmacist Sule Adamu. You are welcome. I can also see Pharmacist Ologe. You are welcome tonight. I can see Pharmacist Anu Oluwapo, and I can see Pharmacist Grace Oluwatoyin. And of course, we also have in our midst Dr. Aike Bello, the Deputy Lead Coordinator of the group. So we are all welcome tonight. So without wasting much time, I would also like to read a brief on the presenter of tonight, and that's in the person of Pharmacist Folashade Ogundele. She is a fellow of the West African Postgraduate College of Pharmacists. She's also a merit award winner, and she's the head of pharmacy, Federal Polytechnic Offa Medical Center in Offa, Kwara State. So tonight she's going to be talking to us on formulating an effective response to drug information questions and to present a structured approach to that response. So last presentation, we had Professor Aino talk to us to remind us about the concept of drug information. And when we talk about drug information, there are inquirers. So when an inquiry is made, there is a structured way to give a response to the inquiry. And that's what we are here tonight to listen to. So without much ado, and without wasting our time, I would like to welcome our guest speaker for tonight, Pharmacist Folashade Ogundele. You have the floor, ma'am. Thank you.
Good evening, everyone. Thank you for joining us today. I would like to share my screen, please. I don't know if you can see my screen. Please, can we see my screen?
Yes,
Yes,
please.
go to
Can see
slideshow then. I want to put it on slideshow. Yes. Everyone can see it now. Good evening, everyone, once again. Well, welcome to tonight's presentation. It's titled Formulating an Effective Response, a Structured Approach. It's from the book on drug information, a guide for pharmacists, the 7th edition. These are my outlines, objectives, the introduction, steps for answering a question, formulating the response, a sample case study, conclusion and reference. Objectives. We have 5 here. To develop strategies to overcome the impediments that prevent healthcare professionals from providing effective responses and recommendations. To outline the steps that are necessary to identify the actual drug information needs of the requisitor. To list and describe the 4 critical factors that should be considered and systematically addressed when formulating a response. To define analysis and synthesis and describe their application in the process of formulating responses and recommendations. To list the elements and characteristics of effective responses to medication-related queries. As we all know, the questions being asked, that's what we call queries. Healthcare, I go to the introduction now. Healthcare professionals are asked to provide responses to verbal drug information questions every day. In our various practices where we practice, those in the community, those in the hospitals, those in the academics, one way or the other, we have people asking questions. They might not necessarily be patients, they might be our colleagues, they might be relations, making inquiries about certain medications they are using or about some disease factors they're experiencing or symptoms they're experiencing. So this module introduces an organized, structured approach for formulating effective responses and recommendations to drug information questions. I implore us to note 7 key concepts that are involved here. They are written in black and italicized. So as medical literature expands, so also drug information resources also continue to grow. Yet many professionals lack the skills to use this information effectively. The first key concepts to note is rational pharmacotherapy can be promoted by ensuring that drug information is correctly interpreted and appropriately applied. This presents an opportunity and a challenge for pharmacists, regardless of where we practice, as I said, that are true drug therapy experts and play a broader role in patient care. So there are steps for answering a question. The first one is accepting responsibility and eliminating barriers. Healthcare professionals should recognize that their sole responsibility extends beyond just providing an answer to a question. We should also assist in resolving therapeutic dilemmas by managing patients' medication regimens for their entire therapeutic outcome. In order to provide meaningful responses and effective recommendations to these drug information questions, real perceived impediments must first be overcome. One of such is false perception that many drug information questions do not pertain to specific patients. The second the key concept to be noted is the absence of sufficient background information and pertinent patient data can greatly impair the process of information synthesis and the ability to formulate effective responses. As we go along in the presentation, we'll see the main basis for this. We need to have enough background information and patient data to be able to give an effective response. Another step for answering a question is identifying the genuine and precise needs. It is in like 3 parts. The first one is evolution of systemic approach. Historically, in the approach, Wantabe answering drug information queries are centered on the use of a systematic method. It was first described by Wantabe and subsequently modified by others. Recently, the American Society Health System guidelines on pharmacy's role outline 9-step systematic approach for responding to drug information requests. This includes, we have to identify the requisitor, we have to define the question they're asking. You know, maybe they asked about the use of antibiotics. So we have to identify first who is asking the question. Is the person a medical personnel or a patient? Then defining the true question, obtaining background information. Is it for personal use? Is it for adults? You know, is it for a child? Then categorizing the question, assessments, performing a systematic search, analyzing the information, disseminating the information, documenting the response, and performing a follow-up. As we all know, whatever is not documented is not done. So documentation is very important. The second step in identifying a genuine and precise need is eliminating potential barriers. Ultimately, the process of providing an effective response will depend largely on maintaining the flow of information with minimal distractions and unnecessary or ill-timed questions. The goal should be to remove obstacles such as those provided by lack of background or situation information when communicating with clinicians to determine the actual information needs, also referred as the ultimate question. Another step is eliciting critical information. Requisitors of information are typically vague in verbalizing their needs. Maybe form of communication, they know how to express themselves. So our questioning skills and listening skills will also help us to be able to get this information from them. Another key concept to be noted is critical information that defines the problem and elucidates the context of the question is not readily volunteered, but must be expertly elicited. That is through our communication skills. We can get it from the person asking the question. This can be accomplished, okay, using effective questioning strategies, and then good communication skills, both listening and questioning and identifying, will help us in discerning the real question, identifying the genuine needs of the requisitor. Another key concept to be noted is providing responses and offering recommendations without knowledge of pertinent patient information. The context of the request or how the information will be applied can be potentially harmful. So it's very important to have a good knowledge of the pertinent patient information, the context of the request, to be able to give an effective response. Also, we need to verify the context of the question being asked. Some healthcare professionals may be quick to attempt to answer questions without adequately understanding the context or unique circumstances from which they evolved. They focus exclusively on the answer and ignore or fail to obtain key information needed to establish the framework of the question. For example, if you ask what's the dose of amoxiclav, readily the person might, the pharmacist or the person answering the question might say, okay, 625 milligram. Meanwhile, there are other doses, 375 milligram for a child, 625 milligram, 1 gram. So there's need to establish the background information to know who is actually using it, you know. Then before attempting to formulate responses, one must consider several important questions to ensure that they understand the context of the query and the scope of the issue or problem. These are questions that need to be asked in formulating a response. For example, are the requisitor's name, profession, and affiliation known? How can the requisitor be contacted? Is it through email or cell phone? Does the question pertain to a specific patient? If so, has pertinent patient history been obtained? Is there a clear understanding of the question or problem? Health information is needed, that is ultimate question being determined. Why is the question being asked? Why now? What are the unique circumstances that generated the query? Are the requisitor's expectations understood? Has pertinent background information been obtained? What information is actually needed? When is the information needed and what format? Is it verbal or written? How will the information provided be used or applied? How has the problem or situation been managed to date? Are there alternative explanations or management options that should be explored? These are questions that we need to consider. So in now formulating the response, the first thing is to build a database and assess critical factors. Formulating a response comprises a series of steps that must be performed completely, objectively, and in a logical sequence. A key concept says formulating the response requires the use of a structured, organized approach whereby critical factors are systematically considered and thoughtfully evaluated. The critical factors to be considered when formulating a response, they include first, the pertinent background information, that's the special circumstances and other factors. The second factor is patient factor. The third is disease factor, and the fourth is medication factor. You can see under pertinent background information, these are just 5 out of many questions, many factors that we can consider. Under pertinent background, you need to consider the setting that the question is being asked, the context, the sequence and the time frame of events, the rationale for the question, acuity and time constraints, then the time to answer the questions, it's part of it. Then under patient factor, demographics, e.g. the name, the age, the weight, the sex, they are part of things we need to know that will help us background information. And then primary diagnosis and medication problem list. These are just some of the factors to consider under patient factor. I just listed 5. There are some others. Allergies, intolerance that the patient might be experiencing, maybe the history, chief complaints, the actual thing the patient is experiencing, is it the headache or is it the fever? Then history of present illness and past medical histories. Maybe they have had surgeries before or vaccinations, immunizations. And then the third factors to be considered is the disease factor. We define definition of the disease, the epidemiology, including incidence and prevalence, the etiology, the pathophysiology, then clinical findings, maybe the signs, symptoms, laboratory tests being carried out. And then the last critical factor is medication factor, which actually involves us, the drug experts. It includes name of medication of substance we need to know, the dosage, the status and availability, whether they are investigational drugs, non-prescription drugs, orphan drugs, then the uses for diagnosis, prevention, treatment, adverse effects, drug interaction, food drug interaction, allergy. These are just some points under these 4 critical factors. Once these data are collected using that 4 critical factors and carefully assembled, they are most critically analyzed and evaluated in proper context before final responses and recommendations are synthesized. A key concept again is approaching a question haphazardly or prematurely, fixating on isolated details can misdirect even the most skilled clinician. That is when there's no background information about the patient, the disease, the medication. It can misdirect even anyone answering the questions. So formulating the response also, there's the issue of analysis and synthesis. Analysis is the critical assessment of the nature, merits, and significance of individual elements, ideas, or factors. Functionally, it involves separating the information into its isolated parts so that each can be critically assessed. It's like when we are doing like a puzzle. I'll link it up to a puzzle. There are different parts in a puzzle. When you're arranging correctly, each part is fixing, you get the true picture of the image you need. But when it's being haphazardly, it's disoriented, you can't get the true picture. So once the information has been carefully analyzed, synthesis can begin. Synthesis is the careful, systematic, and orderly process of combining or blending varied and diverse elements, ideas, or factors into a coherent response. A key concept again is responses to drug information queries often must be synthesized by integrating data from diverse sources through the use of logic and deductive reasoning. This process relies not only on the type and quality of the data gathered, but also on how the data are organized, viewed, and evaluated. Responses and recommendations also help us in formulating our responses. An effective response obviously must be adequately addressed and answer the question. It should also be tailored to the specific requisitor. The response to a question must include a reinstatement of the quest and clear identification of the problems and circumstances. Specific recommendations must be scientifically sound, evidence-based, clearly justified, and well documented. A careful written record of the response must be maintained for follow-up and legal reasons. The records may be confidentially maintained in a patient's medical record or in the provider's secure electronic database. Other characteristics of effective responses and recommendations are outlined in the table below. These are desired characteristics of the response. It should be timely, it should be current, not outdated, asking the questions, maybe there are new information about a drug, you are giving an information from 2019 and we're in 2024. It must be accurate, it must be complete, concise, supported by the best available evidences. It must be well referenced, it must be clear and logical, it must be objective and balanced, it must be free of bias and flaws, applicable and appropriate for specific circumstances. Answers important related questions. You must answer important related questions. You must address specific management of patients or situations, and you must consider local regulations, policies, and formulary if applicable. Very important follow-up in formulating the response. When recommendations are made, follow-up always should be provided in a timely manner. Follow-up is required for assessment of outcomes and when necessary to reevaluate the recommendations and make appropriate modifications. It's a hallmark of true professional and demonstrates a commitment to patient care. Furthermore, follow-up allows the provider the information to know if their recommendations were accepted and implemented. And finally, it allows the provider to receive valuable feedback from other clinicians and to learn from the overall experience. A sample of a case study. There are many case studies, but I just picked one because of time. Initial question, for example, what is the molecular weight of fosamprenavir calcium? The potential response in the absence of a relevant background information is fosamprenavir is an oral antiretroviral agent that is indicated for the treatment of human immunodeficiency virus infection in combination with other antiretroviral agents. The molecular weight of this drug is 623.7 grams per mole. Remember the 4 critical factors we mentioned about. This is one of it, pertinent background information. That's the first one. The requisitor is a basic, that's asking these questions about the molecular weight of this drug. Is a basic scientist who is conducting an in vitro experiment to evaluate the pharmacologic effects of the drug. She would like to know the molecular weight of fosamprenavir so that she can perform appropriate calculations specified for these experiments. The other critical factor is pertinent patient factors. It is not available. Pertinent disease factors, it is also not available. Then the 4th critical factor to be considered is pertinent medication factors. Fosamprenavir is a prodrug that is converted in vivo to the pharmacologically active form, amprenavir. Fosamprenavir is available for prescription use in the United States as 700 milligram oral tablets and 50 milligram per ml oral suspension. Amprenavir has been discontinued and is no longer commercially available in the United States. under the case studies includes analysis and synthesis, considering that Fosempra is a prodrug that must be converted to a pharmacologically active compound in vivo. Excuse me. And given that the researcher wishes to conduct an in vitro study, the researcher should use the active form of the drug in the experiment. Therefore, the true information needed is the molecular weight of the amprenavir rather than fosamprenavir. Our response and recommendations. Fosampra is an oral antiretroviral agent indicated for the treatment of human immunodeficiency virus HIV-1 infection in combination with other antiretroviral agents. Because of fosamprenavir is a prodrug that requires conversion to the active form, the requisitor was advised to consider using amprenavir in the experiments. The molecular weight of amprenavir is 505.6 grams per mole and is available for purchase from several chemical vendors. Sorry, I'm trying to move my slide. Then the case message from the case study is this. This example illustrates the importance of collecting pertinent background information, even for seemingly uncomplicated questions. The question, as originally posed, related simply to the physiochemical properties of the drug. After obtaining additional information, the question ultimately pertained to both the drug's physicochemical properties and pharmacokinetics pharmacology. Failure to understand exactly how the information that is provided will be used could result in an inaccurate or misleading response. In this case, providing the molecular weight without alerting the requisitor that in vitro fosamprenavir is pharmacologically inactive would have resulted in wasted time and money, and the results of the experiments would likely have been invalid. Conclusion. Formulating effective responses and recommendations requires the use of a structured, organized approach whereby critical factors are systematically considered and thoughtfully evaluated. The steps in this process include organizing relevant patient information, gathering information about the disease states and affected body systems, collecting medication information, obtaining pertinent background information, and identifying other relevant factors that can potentially influence outcomes. That is the 4 critical factors we need to have it on our fingertips. Once these data are collected and carefully assembled, they must be critically analyzed and evaluated in the proper context. Responses and recommendations are synthesized by integrating information from diverse sources through the use of logic and deductive reasoning. Importantly, pharmacists must recognize the value and potential benefits of their contributions as members of the healthcare team. These are my references. Thank you. Question time. Comments encourage. Thank you.
Thank you very much, Pharmacist Ogundele.
Thank you, Ma.
A succinct presentation, straightforward and easy to follow. Thank you very much. So like she has said, we'd like to listen to our comments, our questions, and responses. So who wants to go first? Can we indicate electronically? Hello? Okay. I have a question. Are we still on the call?
Yes.
Okay. Okay, so the question is for those of us working in the hospital setting, like for example, an educational institution, like maybe a teaching hospital or an institution that is that engages in training of students. So I would like to find out if anyone has gotten this kind of request, the request in the case study, okay? Request about maybe somebody is conducting an in vitro study and needs information about medication. I just want to find out if we have received anything similar so that we can situate it, situate the lecture in our reality. Hello? Okay. I can't get any response. Pharmacist Agogo, you are welcome, even though you are joining us towards the end of the meeting. We appreciate your presence. I know you are busy with so many responsibilities for CPAN.
Thank you, ma.
Okay, so the question is, have we received a, okay, so another question, let me ask us. How is the patronage of our drug information centers? Do we have a drug information centers in our facilities? And what is the patronage in terms of inquirers? Does anybody want to make a contribution? Are we experiencing patronage in our drug information centers? And if we're not, what do we think are the issues? Or maybe the question I should reframe it. Do we have drug information centers in our facilities where we're working? Do we have drug information centers? Please, I don't want us to sleep on me. Oh.
No, we're together. Sorry. It's network issue. We're together. Dr. Joe.
Okay.
Hello.
I
can hear you.
I can hear you, Dr. Bello, but I'm not getting anybody's response or comments.
Okay. Me, I had a little challenge with network, but I'm back now. To me, the lecture was well delivered and well treated, because every day as pharmacists we receive queries on drug information. But most of the time, we do not follow standard in managing this information. And tonight, she has come to put us through on how to manage drug information queries, which I believe all of us must have been impacted greatly with our lecture. I want to congratulate her for that one. It's a beautiful one. Yeah.
Thank you very much, Dr. Bello. We are in agreement with you that Pharmacist Ogundele did justice to the topic. And to remind, this is to remind us about the need to standardize our responses. And in particular, the need to caution ourselves before responding to a drug information request. So, because it appears a lot of us are quick, somebody asks, what is the dose of anti-malaria? And we just go out, we start talking. But we need to establish who is taking the anti-malaria. Are there other comorbidities that could that warrant medication being used that could contraindicate the use of the anti-malaria? Is it for a juvenile? Is it for a child? Is it for an adult? You know, those are issues that we need to consider before we jump to answering the questions. Because from what we know about clinical pharmacy is patient-specific. So it's no longer general information. So we need to get patient-specific information that would help us to be able to address and give the appropriate information. And for me tonight's presentation was a reminder on the contribution of drug information to rational use of drugs. I think it's in the first the first or second slide that she highlighted on that it contributes to rational pharmacotherapy. When we give appropriate information, then we are able to ensure that the drug is used in the right way, the right dose, the right indication, and it's going to produce the right outcomes in our patients. And that's very, very, very pertinent, and that's very, very key. Is a key takeaway for us tonight to know that drug information services is contributing to rational use of drugs. So having said that, I don't know if anybody has a question to the presenter, or you have a topical issue related to the presentation that you want us to quickly look at in the next few minutes. Anybody?
Yes, my own comment is that there is in this module, there is a form for documenting responses to drug information queries. I didn't see, not mention that form. So for any response that pharmacists give, it must be documented, and there is a standard way of doing that. So I think the form should be made available so that in our own various settings, whenever we provide any information to anybody, because of its legal and ethical implications, it must be documented. I think the form will be made available on our platform. And number two, we should not be discouraged with the number of attendees, because on the regular pharmacy platform, we're only 15, and we only expect our members to attend this training. So we should not bother with the number that attended, and to encourage us to please attend, those of us are registered members, because if we follow through from module 1 to 30, I want to assure us that we will not be the same again. That's my comments. Thank you so much.
Thank you very much, Dr. Bello, for those reminders on the need to document. I can also see the comments in the chat box from pharmacist Sule Adamu. Okay, this is a response to the question I asked about our experience with drug information services. And his response is that the drug information inquiries is not so much in his place of work, which is and he works in the National Hair Care Center, Kaduna. The ENT is an ENT hospital, and most of the drug information requests is regarding availability, the formulations available, and the strength. So he's trying to tell us that questions are not really asked about maybe indication, duration of use, or other questions about contraindications and all of that. But at least in their facility, they have a drug information center. That's the information is passing across to us. Pharmacist Olani, I can see your hand is raised up. Please, you have the floor.
Yes, ma'am. Thank you so much, ma'am. Thank you for the presentation, Dr. Folashade. I would like to say, with easy access to technology now, everybody seems to have access to information. So patronage on some aspect of drug information might not be coming in as expected, because Google is just a click away. But where professionalism comes in now is going through the checklist, as highlighted by the presenter. If we're going to do rational pharmacotherapy and we go through these checklists, it will distinguish us from what Google will say. A lot of people can access Google, but Google would not identify some things, will not put rational consideration into place when it comes to some things. Some people might not know how to filter those information. So that's where the professionalism comes, and I think it stands the center out. So patronage may not be so high because of easy access to the internet.
Okay. Thank you very much, Pharmacist Olani. That is a very apt, is an apt contribution. And I like the reminder from you about the need for us to bring in our professionalism, to the table and distinguish ourselves as professionals. And like you said, there's a lot of information out there, but we need to be able to synthesize, which is part of what was highlighted tonight in the presentation, that we need to, do after doing a systematic search, we need to analyze and synthesize the information and apply it to the question. So I think that is where the professionalism really comes up, okay? Ability to apply to the situation at hand. And that's what will distinguish us as professionals. So thank you so much. If we do not have any other contribution or question, I would like Dr. Bello to give his remarks as we look forward to rounding up the meeting tonight. Over to you, Dr. Bello.
Sorry, please.
Okay, thank you, Dr.
I'm sorry, Doctor. I was going to say that network cut me off, so I had to use another phone. So I don't know if there was any question or anything, or maybe comments later can come in the main platform, the group platform. Thank you. Sorry, Dr. Bello. Please, you have the floor now.
Okay, thank you so much. You have received many commendations, and we said you have done very well. Everybody has commended you. So, in my own little remarks, I want to thank us all for coming again for this edition, the second edition of our training. So we are on module 2 now, and the next one will be module 3. I want to encourage us to be part of this to the end, and I believe at the end we all give thanks to God. Then I want to equally recommend to all different centers that we should subscribe to drug information hub like Lexicon. I know we have a free hub like a drugs.com. And if you can equally afford to subscribe to Lexicon online drug information, we'll be rest assured that we are giving information that is up to date and reliable. And for the case of people that are not receiving queries from outside, you can equally give active information by giving out information you have on medications. You don't need to wait for people to come into you. Once you have drug information references applications, you can go through them and provide information actively instead of waiting for people to come in. Like it was said, people will not come in now because they have access to information online. But if you, as a pharmacist, as a drug information expert, you have resources that is evidence-based and reliable, you're able to have that confidence to provide up-to-date information. So I'm encouraging us to subscribe to Lexicon online drug information applications. Though we have free ones like drugs.com, but if you have many, we have that confidence to provide evidence-based information. So once again, I want to thank us for coming. To equally remind us that next time is going to be the time for this third module of our training. Thank you all. Over.
Thank you very much, Dr. Bello. Thank you very much, Dr. Bello, for those timely reminders and enlightenment on how to keep our drug information services as robust and to adjust to the need. In our facility, we started doing a newsletter. So that's a way to provide active drug information. So we started a quarterly newsletter, and the whole idea of the quarterly newsletter is to respond, to what we observe about the use of drugs or how drug information is passed out, in the facility. So, for example, our first edition was something on antimicrobial stewardship, like a reminder, to healthcare practitioners in the facility. So while we are waiting for them to become active inquirers, we can push out, we can take the drive, out by taking on active drug information through newsletters, which can be shared on our various digital platforms, in our facilities. So on these notes, we have come to the end of tonight's meeting. So we look forward to a more robust participation next module by the grace of God. And let's also try and encourage participation by members on the module presentation. And also, I want to challenge us to be ready to be involved. We have a timetable, we have a roster, and randomly would also need moderators to support the presenters. So everyone should be ready. I expect that as drug information specialist, one of the skills that we should acquire is communication. So because I remember I put out the request to 2 members of the platform, and the excuse they gave me is that someone said it's not very good. In fact, the other one too said, but I feel that it is by trying that we become better. So let's take up the challenge and let's not draw back. The more we communicate, the better we become at communicating. So on this note, I would like to ask someone to give us a closing prayer. Any volunteer, please? Closing prayer.
Okay, let me pray. Yeah.
Okay.
We want to give thanks to God Almighty. We give thanks to God Almighty for giving us this opportunity to have our upper lecture, the second one. We thank Him immensely, and we pray that He continue to be with us and to bless our effort. As we are going to our various places to rest, we pray God Almighty to be with us and our family, to bless us abundantly. Amen. Subhana rabbika rabbil izzati amma yasifun. Amen. Over.
Amen. Thank you very much. So good night, everyone, and have a wonderful night rest and a refreshing week ahead. God bless you.
Good night.
Bye.
The recording of the recording will be made available. Actually, the slides of our presentation will be made available.
Thank you. Good night.
Thank you very much. Thank you to our presenter and to our participants. God